you wanted us. You were crying out that you bypassed the harder team in Miami Heat.
Roach came down bad on his left foot. See him holding on.
Yeah, it's before he comes down. It's the plant right there on that left leg.
Some give. Now, whether it was an ankle or a knee, I do not know. There's Coach Collins out there and all those teammates running.
And now has dropped back. Vaughn over the top, and she is down heavily. Instantly, he knew he had a problem. He would be carted off the field and taken to the hospital for further evaluation. Gronk reportedly has a torn ACL.
Gus and Randy concerned in New England over this hit here. Watch Tom Brady's left leg hit right there, bent awkwardly, hit by Bernard Pollard.
It's all good when Tom Brady's in his 20s. And by the way, it's even better when he hasn't suffered a season-ending knee injury.
My name is Kyle Froberg. I run South Carolina Orthopedics Sports Performance. What I end up doing here is I oversee a staff of about 5 people. We do a lot of personal training. We do boot camp style classes. My qualifications is a 4-year degree from University of Rhode Island. In my field, you have to have some sort of 4-year degree. And then also certification as well too. So my certifications are National Strength Conditioning Association, so NSCA. I have a CSCS, which is Certified Strength Conditioning Specialist. The bit of advice I would give for somebody that has a recent injury would be first to understand what they're going through, because it can be depressing. If you're an athlete and you're at the top of your game and you get injured, then you really got to understand what's going on. It's not set in stone, but it's usually about a year where you get back to sport. Unless you're a professional athlete and you're Jerry Rice and you come back in 6 months, it's very hard to do in that time frame.
Hi, my name is Matthew Dinella. I'm one of the PAs over at South County Orthopedics. I recently graduated from Seton Hall PA program in New Jersey, where I graduated with my master's degree, and I've been working at South County Orthopedics for about going on a little over 3.5 years now. So what we have here, we have just a model of representation of the knee. So whenever you look at the knee, you look at the knee at about 3 compartments. So you have the inside, the outside, and underneath the kneecap. So the medial, the lateral, and patellofemoral compartments. Just looking at the knee on the outside, you have the patella tendon, you have the quadriceps tendon, which drapes over the kneecap. On the outside, you have the LCL, which is the lateral collateral ligament. You also have the MCL, which is the medial collateral ligament. So if we retract this patella and its tendons, and we look at the inside of the knee is comprised of basically patella, your kneecap. You have the femur, which basically is comprised of a lateral and a medial femoral condyle. You have the meniscus, which is basically the shock absorber right here, and you have a medial component as well as a lateral component. You have the anterior cruciate ligament, which is the ACL. You have your posterior cruciate ligament, which is the PCL. And you also have the tibia, which is basically your shin bone, and it's comprised of a medial and a lateral tibial plateau. Here at South County Orthopedics, we take pride in the work that we do as far as helping athletes get back to basically playing the sports and doing the things that they love. We treat many different ailments as well as knee, hips, ankles, and shoulder injuries throughout on a daily basis. Number one being the ACL rupture. As far as surgery is concerned, for any ACL type injury, whether it's a rupture or a tear, and there are a bunch of different grafts, a bunch of different techniques. What we utilize here with Dr. Burns at South County Orthopedics is ACL reconstruction with an Achilles tendon allograft. Now, an allograft is basically a graft that's harvested from a cadaver. It's not necessarily from yourself. An autograft, on the other hand, is something that's harvested from your body and used in order to replace a ligament or a tendinous structure. So what we do, we use these Achilles tendon allografts. They're flash frozen, and we use them in the operating room in order to replace the torn ACL. And the surgery itself takes about an hour. It's all done arthroscopically, so there's 2 small punctures in the knee and 1 tiny little incision right at the tibia. Usually the surgery itself, Dr. Burns can get a good visualization of what is going on inside of the knee, if there's any other structures that were harmed during the whatever mechanism of injury caused the Achilles tendon to tear, or the ACL to tear. Usually the Achilles tendon is fixed by drilling a hole in the tibia up through the femur. We use a toggle lock system that prevents the graft from coming out, and as well as an interference screw at the distal end of the graft in order to hold it into place.
So the general steps for the transitional ACL program is surgery, if needed, and then we get them right to physical therapy, hopefully within the first day to week or so, depending on how bad the patient is. Usually it ends up lasting about 10 to 12 weeks, depending on how they're progressing. And then they transition over to us, which we get them back to sport. Really important to get range of motion and flexibility immediately following the surgery. So if you're getting a bit of swelling or scar tissue, physical therapists will know how hard to push you, if they need to be pushed, or if they just kind of go along that same protocol that they're following from usually the doctor. It's important to follow those steps. If there are any complications, physical therapists will know what to do, and if they need to be sent back to see further assessments from the doctor or physician. So at South County Sports Performance, we run a transitional ACL program. We get people who injure their anterior cruciate ligament, knee ligament, and we get them from either a preventative state, or we get them from a surgery. And we get them from physical therapy, and then we try to get them back to sport, whatever sport they play, or if it's just regular activity. We get them back to sport as quickly as possible. Usually timeline anywhere from 14 weeks out to about 24 weeks, and depending on the individual and their readiness as well. So a few ways to minimize your chances of ACL injury are, my number one would be strength. So as long as an athlete or individual is strong, mostly in their hips, the core strength as well, so anything that crosses the hip joint is the major factor in a lot of things. Studies have shown the stronger your hamstrings are and your glutes, the less injury or incidence of ACL injury. It's not set in stone, but keeping hamstrings and glutes and core strong will help prevent ACL type injuries. Something that I enjoy really a lot about this is when somebody doesn't need my services anymore and they can go back to sport. And the biggest success I have is knowing that they've gone back to sport and are feeling great, injury and pain-free.